Trumpcare or Obamacare? This has been a discussion in my office. Lots of people ask me about these different care systems. Let me expand that for you for a moment. Trumpcare or Obamacare, or Romney care or Clinton care? Which one is best? And the answer is none of them. None of them are going to work. It's trying to patch a broken system. Our system in this country is a disease care system mostly. We get under chronic disease management, and that's something that's never going to work. We can't turn people around if we're not going in and saying, let's change most, not all, most of these chronic diseases. The big ones are heart disease, cancer, diabetes, Alzheimer's and dementia, and chronic pain. If you look at that bucket, that's where we're spending the vast majority of our money, and I'll get into the money in a moment. None of these cares, Trumpcare, Obamacare is hot topic now, or the prior ones, Romney care or Clinton care and so forth, those systems won't work because it's broken. It's a system that says, your blood pressure is rising, but it's not high enough yet. I'll check it again in 6 months or a year. If it gets higher, we'll put you on medication. That's waiting for disaster and then trying to patch the holes. Your blood sugar, it's not that high yet. It's coming up, but when it gets to a certain level, we'll give you a medication for that. And then, of course, a lot of people that get on the high blood pressure medications oftentimes never get off them, right? They get on the sugar medications and they don't get off of those. You've got a few less than healthy cells growing. When that gets bigger, we'll cut, poison, and burn, or the standard cancer therapies in this country, without the iron prevention. And I've done the cancer shows in the past, and we know that 95% of cancers are because of our habits and lifestyles, not because of genetics, only 5% due to genetics. So we can prevent a lot of those cancers from happening, which is devastating to families, devastating to people, of course, and extremely expensive. Then we look at dementia now, rising faster here than anywhere else. And by the way, the United States, which country in the world has the highest rate of cancer? United States. Interesting. And then we look at dementia and Alzheimer's, and we think, what's going on here is we're letting brains deteriorate and degenerate, not taking care of them with good, healthy diets, lots of exercise, appropriate sleep, taking care of our spine because the spine is the number one electrical feedback to the brain to keep the brain working, not taking care of people's stress. And then their brains deteriorate, and then we put them on medications, experimental medications, and then institutions. And that is extremely expensive. So if we think of one thing that will bury this healthcare system, or disease care system, more than a healthcare system, it is Alzheimer's dementia. That's the thing that's going to sink us. Okay? Or you look at people with chronic pain, and I've done these statistics in the past for you. Chronic pain, 100 million of 200 million adults in this country have chronic pain. The number one area for chronic pain is the lower back. So now we put people on medication. You've got some pain, here's some medication. Now you've got longer term pain, here's some long-term medication pills. Here's some over-the-counter pills, because you're taking that. Now here's some stronger medication, and that's not working or not working effectively enough, and now we have an opioid epidemic. More on that later. You see? That's a broken system. So, in summary for the beginning of this, Trumpcare or Obamacare, it doesn't matter. The system is not going to work. We're already spending $4 trillion a year in this country, or close to it, depending on who you look at, on our disease care system, our chronic disease management system. And that's something that we just can't pay for. The income for the United States, taxes, the income is only 2.5 or 2.9 trillion or whatever it is. And now the cost of healthcare is 4 trillion and so on. As you now know, our country has a deficit of 20 trillion. That's only the deficit. But if you add in the unfunded liabilities of Medicare and Social Security, we are $120 trillion in the hole. And again, we're taking in less than 3 trillion in revenue each year in taxes. So these things are unsustainable. With our current disease care system, unless we turn it around, and I will show you in a moment some ideas to turn this around, is we need to turn it around now, or healthcare, disease care costs will bury us. And my timeline is 2050. The United States is done by 2050. We are just not going to be able to fake clouding over with the creative accounting that we're doing right now, being $120 trillion in debt. And that's only going to get worse unless we change things, including the disease care system. $4 trillion a year, according to Forbes. Sugar, as I've talked about in the past, just sugar, all of the added sugar that we all take in is 25% of the cost of all those chronic diseases, $1 trillion. So if we all help each other, because we're all on the same team, you need to help me, please. I need to try to help you. We all need to help each other to fight processed food and stay away from those addictive foods and move more towards locally grown, organic fruits, vegetables, and grains and meats and so forth, right? For all the money that we're spending, we spend number one. We're number one in spending. We spend more per person, $10,000 now per person, than any other country in the world. We spend a higher percentage of our GDP on disease care than anywhere else in the world. For that, we're number 37th in our healthcare system rankings according to WHO. We're 40th in life expectancy, and by the way, we just had a recent drop. Each year, most of the countries that go up by a tenth or 2/10 of a year, or maybe half a year or something like that. We actually dropped in 2016. We went down a little bit. We're 17th in the happiness index. Now remember, we have the best emergency care in the world. We do have the best emergency care, the best nurses and doctors and assistants and first responders and so forth. But for prevention, we get an F with all the money that we spend and all the people that we have. Now, there are side effects for our disease care system. I've talked about these in the past. You need to be aware. This is why Trumpcare and Obamacare won't work unless it's a complete shift. I'll get into the shift in a moment. 440,000 people a year die from medical mistakes. We've known that since 2013. Out of that, 100,000 of the 440,000, I think, meaning I think that number is out of that number. It's not an added number. That would be even worse if it was in addition to, is from hospital-acquired infections. So in 1 year, 100,000 people walk into the hospital and they get an infection and they die. 106,000 people a year die because they took the correct drug, they took it in the correct manner for the correct diagnosis, which means no mistake was made. No mistake, 106,000 people a year die. If you add those numbers, 440 and 106, we're at 546,000 people a year die because of our disease care system in this country, making it easily the number 3 cause of death, just behind heart disease at 614,000, just behind cancer at 592,000. Number 3 is medical care at 546,000. That number is equivalent to 21 full jumbo jets going down every week, just to put that into perspective. Now, I want to talk a moment about pain drugs because of the opioid epidemic. Again, the numbers are 100 million out of 200 million adults in this country have chronic pain. The number one source of chronic pain is your lower back. I'm going to talk about that in a couple of minutes, how we can address that and turn that around. So that means that chronic pain, 100 million people, they're going to get care, they're going to their doctor, they're going to their nurses, they're going to their nurse practitioners, they're getting lots of prescriptions. Cost, 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 cost. If we can turn around some of those people and prevent some people from getting into those numbers later on, that is a huge cost savings. Now, I want you to keep in mind that non-steroidal anti-inflammatory medications such as ibuprofen, Advil, Aleve, naproxen, and so forth, those are the non-steroidals. They kill conservatively 16,500 people a year in this country just taking those medications. That's the ibuprofen and Aleve, and that's also aspirin. Prescription Celebrex and diclofenac, they are also non-steroidal anti-inflammatory medications. So people are taking these things a lot, and they end up not only harming themselves and having liver damage and kidney damage and stomach and gastrointestinal damage, but they're also dying from them. Remember that Vioxx killed 60,000 people in 5 years. Vioxx killed more people in 5 years than the Vietnam War did in 10 years. But that's okay, Celebrex is fine. Acetaminophen kills approximately 458 people a year. That's in the active ingredient in Tylenol. 78,000 people a year end up in the ER for acetamin toxicity. And the problem is in the liver. And that is a huge stressor on the liver, taking these things particularly with alcohol and particularly over time. The opioid epidemic now, the opioid epidemic is people are dying, approximately 20,000 people a year are dying from overdosing on these medications, 20,000 a year. Everyone's thought process is that these numbers are probably going to go up. 100 million of it, 200 million people, as I said, are in chronic pain, so we need to address that. Our own CDC, Centers for Disease Control, is now saying, again, regarding the cost of the healthcare system in this country. With obesity, obesity is a huge cost that feeds into the heart disease that I mentioned. It feeds into the cancer, one of the biggest causes of cancer. It feeds into the dementia and Alzheimer's. It feeds into the diabetes, and it also feeds into the chronic pain, obesity. Obesity rate in 1960 in the United States was 10%. 1990, 30 years later, 15%. By 2013, it was 36%. We now know that 3 out of 4 adults in this country are either overweight or obese. Only 1 out of 4 is of ideal weight. That needs to change. That is another symptom. That's another canary in the coal mine of what we need to do to turn around ourselves as individuals, ourselves as families, as communities, and then, of course, turning around the disease care system into a healthcare system. Our CDC, again, has said that 75% of what we're spending our healthcare dollars are for things that we can prevent. Things that we can prevent. So, $4 trillion a year on disease care, we can knock that down to $1 trillion a year by eliminating the things that we can eliminate. Let's be conservative. Let's say that 75% of these diseases we can't turn around, but we change it by 25%. We've just taken healthcare from $4 trillion to $3 trillion. Problem solved. We can afford it. Anytime you can save 25%, imagine that. The cost of healthcare goes down 25% next year. That's fixing the system, but we're going to have to take some serious action to make that happen. Dr. John McDougall has said 80% of sickness, of all these chronic diseases, is due to food poisoning. That means the food has gone bad. It's the food choices that we have, much of which is not our fault. If you read Michael Pollan's work and everyone else's work that talks about that these foods are addictive, if you, and by the way, this is a great resource for you, go to YouTube, type in Robert Lustig, Sugar, the Bitter Truth. You're going to come to a 1.5-hour video on sugar. I think there's about 6 million hits on his video right now. He gets into some liver biochemistry and he talks about how sugar stresses the liver as bad as alcohol does. If you don't want to go into the long 1.5-hour one, which is fantastic, then put in Robert Lustig TED, meaning a TED Talk, and you'll get a 20-minute talk on how sugar is really harming us and really causing some serious trouble. Now, Forbes is coming out and saying $1 trillion of $4 trillion each year is due to just sugar. So we need to really take a look at that. We need to, again, work together. Please help me. I need to help you. We're all addicted. Processed food companies know we're addicted. That's why they put sugar in everything, and you can't say no, and so on and so forth. To make a change, we need a new way of thinking about our own health, the health of ourselves, the health of our family and our children, the health of our community. We need to start thinking of our bodies as this wonderful, amazing, gorgeous machine that it is. And we need to take care of this machine and have the appreciation and gratitude for it, like we do the stupid things that we pay attention to, like our cars. And we have this intensive maintenance schedule for our cars, right? It's running great, oil change. Running great, wash and wax. Running great, tune-up. Running well, rotate the wheels, and so on. We have this major maintenance schedule to try to prevent major catastrophe. Let's take that philosophy and apply it to our bodies. Much, much more important. If your health goes south, do you really care about your car? Probably not. We need to think about it like our teeth. Teeth care. It's burned into us. Dentists and dental hygienists and so forth have done a great job in teaching us, hey, you've got to take care of your teeth. Brush and floss every day. Don't use fluoride toothpaste. More on that on another show. Get fluoride out of our water. Stop putting fluoride in our water. Take care of your teeth. Use a powered toothbrush. Try to avoid sugary snacks. Avoid things in between meals and so on and so forth. And then come and visit us every 6 months. And even with that intensive daily maintenance schedule for our teeth, we still have to have professional scraping of our teeth and so on and so forth. Take the philosophy of cars and teeth and apply it to our spine and our body. That's what we try to do. And myself as a chiropractor, I'm talking about this every single day with every single patient, not only just spine, but I'm talking about nutrition and exercise and posture and breathing and stress reduction and sleep and water and reducing sugar and helping our infants and children and making our bodies healthier, moms and dads, before they become parents, and then setting up a household that ends up being a reservoir. It ends up being a sanctuary, a nutrition and health and wellness sanctuary from all the minefield that we have to navigate in our communities, from the fast food places to snack foods that are all around us, to all the marketing that is given to us directly on media and so forth. You try to create that sanctuary, and I talk about that all the time in my office as trying to do as much prevention as I possibly can. There are some fantastic healthcare workers, nurses, doctors, clinics, and so forth trying to do the same thing with the resources and time that they have. And I applaud you for doing that. We all need to step up and help each other in doing this, or we're in huge trouble. Now, the countrywide solutions that I'd like to talk about is as follows. If we were to change the disease care system, again, it doesn't matter if it's Trumpcare or Obamacare, either one is not going to work, sorry to say. Now, it is going to work in some circumstances to help people that have no coverage and they need some sort of intervention. It's going to help them, and Obamacare, you can argue, has made some changes there and so forth, okay? But I'm not just talking about medical insurance coverage. What I'm talking about is helping people with health and wellness, okay? So let's say I was the president. Now, I want to tell you that I will never be the president, okay? Because I would never get through the Iowa caucuses, because this is point number one. Point number one is that we subsidize, as a nation, we subsidize monocrops, large monocrops. Our government takes our tax dollars and subsidizes monocrops, corn, soy, sugar, and so forth. We make those crops cheap. We keep the big farms in business so they can be big farms and produce these huge monocrops, which makes processed foods cheap. Sugar is cheap. High fructose corn syrup is cheap. Processed foods are cheap. Organic, locally grown vegetables are more expensive. People on fixed incomes are forced to go and eat processed foods. People in the Women, Infants, and Children program are given juice. They're given juice because it's cheap. You read Robert Lustig's book, Fat Chance. People ask the question, well, why are they feeding me this juice that is giving me diabetes, that's giving me non-alcoholic fatty liver disease, which is having teenagers needing liver transplants because of non-alcoholic fatty liver disease. We're giving it to them because it's cheap, and we have to stop that. So if I was president, which I never will be because I would never make it through the Iowa caucuses, because I would say we're going to stop all subsidies for monocrops. We're going to turn that around, and we're going to start subsidize local organic farms, or we'll take the bigger farms and keep them as big farms, but we're going to change them to organic. If that's not possible because they have GMO seeds and messed up soil and stuff like that, then we'll employ those farmers onto smaller farms and have them change over into the organic system, and we will subsidize that. So we'll take the cost of organic vegetables and fruits and grains and meats and bring that way down, and we're going to take the processed food costs and make them way up, okay? We would also change the way that we do the second part of the system, which is food aid to people, food stamps, the SNAP system, WIC, and so forth. We're going to change that. And so, as I've talked before in other shows, we would take soda, and we would make soda $10 a bottle. And we would take a bunch of broccoli and make that a nickel. You see? We would take a bag of chips and make that $20. And we would take a bunch of asparagus and make that 3 cents. Okay? That's how we would flip-flop that. And I bet most, it's just a bet, I bet most people who are under these subsidies, that are under aid from all of us, would say, if you could bring me food like that and make it really cheap, and even cheaper than you're saying, I'd be happy to buy it and consume it. I'd be all in, because I want myself to be healthy. Most importantly, I want my children to be healthy. But if I can only feed them these boxed things and these packaged whatever for breakfast, lunch, and dinner, and I watch them grow up to be unhealthy and they never are allowed to become the best version of themselves because I'm stuck in the system that's broken, yeah, absolutely, bring that change on, Dr. Fuller, and do that. Because I wouldn't be president, what I would do is, let's say I was then part of or head of the task force to completely flip-flop how the system works right now. knowing that I could absolutely not do it on my own, and there's many people out there that are much more talented than I am that could do these things, I would have all of these doctors and researchers come in, anybody that wants to, anywhere from Lauren Cordain to John McDougall to Robert Lustig to William Davis to Dan Murphy to whoever. I'd gather all of these minds, Dean Ornish and Angel Weil, and the list goes on and on and on. And we would just pile these people together, anybody that was willing to, and they would all be advisories, and we would come up with this system of how we would deliver more important nutrition to people. We would also wrap in the exercise thing and so forth, right? Okay. So here we are as taxpayers, here we are in the broken system, we are paying to subsidize these monocrops. Then we're only allowing people under these food aid systems to buy unhealthy processed foods that give us the heart disease, the cancer, the diabetes, the Alzheimer's, the chronic pain. And then when these people get these chronic diseases, they enter the disease care system, the broken disease care system that I just told you, which is, for the most part, not going to be a solution for them. It's just going to manage this chronic disease, allowing them to deteriorate in many cases, and it's extremely expensive, and it's completely bankrupting the country. So we're paying 3 times for the same conditions, if you will. We're paying to subsidize the monocrops, we're paying to give food stamps and aid and the SNAP program and the WIC program and so forth to people, but they're in a pinch because they can only stretch their dollars so far, and if the cheap foods are the processed foods, that's all they can get, so they end up getting that. Plus it's addictive, these foods are addictive, so we have to put them out of sight cost-wise, right? Just like we did with tobacco. Every time tobacco goes up, some people quit and so forth, so we have to do the same thing. And then we have to not allow these chronic diseases to enter the disease care system. Of course, if people don't get sick, then they won't need to enter for the heart disease, cancer, diabetes, Alzheimer's, and chronic pain. See? That's how we're going to do it from the top down. Now, the top down, as you can imagine, would be a huge undertaking. And it might be a pipe dream, right? It might just not be something that can happen. I totally get that. I think about this every single day. How can we help fix the system? Okay? I know the system is so huge. If we were to try to turn it around today, the entire economy would fall apart because all of a sudden, all the people taking long-term pharmaceutical medications would not be taking them anymore. And by the way, if we were a pharmaceutical company, you and I watching the show right now, if we were we had a company and our job was to produce drugs. I'm not saying all drugs are bad, no. If I got run over by a truck and I lived, and great emergency personnel and doctors and nurses and assistants helped save my life and save my limbs and put me together again, there are medications to save my life, there are medications to get me over the hump while I'm recuperating and so on and so forth, and there are surgeries and expertise and research and instruments and equipment and so forth. I mean, it's a huge undertaking. I understand that. I'm not saying that about that part, but what I'm saying about managing preventable chronic diseases, that's what I'm talking about. If we had a pharmaceutical company, our job, our ideal, our business model is to get as many people on as many long-term medications as we possibly can, because then our company grows and becomes huge, right? Then we're a public company, then we're playing on Wall Street and we're doing all this stuff, then people invest money in us and so on. You can see how this tangled web just starts to increase and gets really out of control when you've got these huge companies. Think about these fantastic jobs that pharmaceutical companies have, that big food has, these huge processed food companies. But let's go to pharmaceutical companies. Look at these jobs there. A lot of them, not all of them, but a lot of the jobs are high-paying, great wages, unbelievably wonderful benefits with Cadillac medical insurance, 401ks, disability insurance, life insurance, and so on and so forth. The benefit plans are astronomically wonderful. A lot of companies can't even offer that right now. So imagine this whole team of myself and these wonderful doctors and researchers and volunteers and so forth. We come together and we start changing the system, and then we realize these big, huge companies with these awesome jobs start declining, and then people start losing their jobs. There's going to be trouble. There would be trouble. Can you see how difficult it would be to change the system, right? So it's going to have to change slowly, but a lot of us don't have time. We don't have time if we're coming up to heart disease, we're coming up to high blood pressure, we're coming up to diabetes, we're coming up to dementia and Alzheimer's, we're coming up to cancer, we're coming up to chronic pain, or we have some of those things and we need to turn them around, maybe with some answers that are not pharmaceutically based. We're going to have to take action now. And that's where it comes to phase number 2, is you. That's the last part of this that I wanted to talk about. It comes up to us as individuals. And I try to do this in my office. I try to do it in my life and with my family and my friends and my neighbors. And then, of course, the people that are coming in that are my patients. I try to do this one-on-one as best we can. I say, okay, changing the system, as I just said, would be a Herculean task. It would just be amazing and awesome and doable, I think, but we'd have to have a lot of people on board ready to make this happen. So right now, today, starting today, taking a Tony Robbins approach, you set the goal, you said, I'm going to do this, and then I'm going to write this down, and I'm going to write a letter to myself, and I'm going to do this, and I'm going to get my family on board, and we're going to make a commitment to make this change. And maybe you're going to step up after you do your family, you're going to work with your school, and you're going to do that. You start small, maybe in the community. There you go. We're going to probably have to do this from the ground up, where so many of us just say we're sick and tired with a broken system that's not working, and we're going to change our own lives and improve our own health. We can't do it in all cases, I understand that, but we can do it in most cases. And we're going to do this working together. We're going to clean up our nutrition to the best of our ability. We're going to get some regular physical exercise. We're going to take care of our spine. We're going to be under wellness chiropractic care. Myself and my children are going to be under wellness chiropractic care to take care of the spine, the nervous system, and the brain. We're going to reduce our stress. We're going to try to live in a beautiful state every day, as Tony Robbins suggests. And that's something that we should all work towards. No matter if somebody treats us harshly, we're going to live in that beautiful state and live with gratitude every day. We're going to drink more water. We're going to get rid of the juice and soda. We're going to get a little bit more rest if that's what we need. And we're going to take care of it ourselves as a family. Now, taking the Jack LaLanne approach, of course, is wonderful. Having a great diet, working out every day until the week that you pass away, having a fantastic attitude, and Jack LaLanne was a chiropractor, so he knew the importance of great healthy spine, good posture, flexibility, ongoing chiropractic care for longevity and health. Jack LaLanne would be a great role model. Just a couple of minutes on chronic pain and what chiropractic can offer to decrease the cost of the disease care system. As I've said before, chiropractic and bedwetting. In 1992, Dear Abby had a letter that said, a parent wrote in and said, my 15-year-old boys were still daily bedwetters, took them to the chiropractor, it's gone. Dear Abby said, I have several hundred letters that say the same thing. I'm not kidding, not giving a commercial for chiropractors here. I had to be truthful and get that out there. Can we imagine how many doctor's visits we would save if we were working on children to see if chiropractic might help them? Chiropractic and ear infections. I have had many, many cases of ear infections, chronic ear infections get better. Think of the suffering that would be avoided in that child, the suffering by the parents, the costs that would be saved of all the pediatrician visits and the antibiotic prescriptions and so forth if people tried that for their kids, or maybe, again, wellness visits for their babies and children. Chiropractic in children, we talked about safety, nursing dysfunction. How many lives could be impacted if we had our babies checked when they were having nursing dysfunction and brought to the chiropractor and improved? Colic and long-term colic, again, expense, stressed parents, cost would be saved. Chiropractic and reflux, I talked about that wonderful reflux case that I solved in 6 simple, inexpensive chiropractic visits. They had already gone to the pediatrician, special pediatrician, gastroenterologist, on medication, costs, thousands and thousands of dollars saved. Chiropractic for pain in 1990 by The Lancet. 741 patients had better outcomes than the hospital patients. Chiropractic versus Celebrex and Vioxx. We went head to head with Celebrex and Vioxx, and we had a 47% reduction in pain and improved health and wellness as compared to only 18% in the drug group. Much, much better, much more cost effective, and 1 year later, sustained relief in the chiropractic group, not in the drug group. So we're going head to head with this. Chiropractic versus diclofenac. Chiropractic adjustments significantly better than drug and placebo. Think about the money we could save by having 100 million of 200 million adults trying the chiropractic thing along with nutrition, along with exercise, along with stress reduction, and how much money and suffering and pain and misery that could be saved if people would just try it. And again, not only just the thousands of people in my office, but the millions of chiropractic patients and all the other chiropractic offices that have been helped. And those people are always out there saying, hey people, at least just give it a try. Chiropractic long-term back pain relief, this next research article shows us. We have now 3 good chiropractic research articles on chiropractic care reducing high blood pressure. How much of an impact could that be? How much money could we save? Chiropractic and high blood pressure, one research article, another research article. Chiropractic and fibromyalgia showed to have benefits. How many people with fibromyalgia are going to doctors and doctors and more prescriptions with tens of thousands, hundreds of thousands, millions of dollars in care just for one person throughout their lifetime. Cervical curve, working on that, and that's one of the goals of chiropractic, and that reduces neck pain by even a factor of 18 times. Text neck, a serious problem, did a show on that. We need to turn that around, talking about posture. So we know that it doesn't matter whether we opt for Trumpcare or Obamacare, the system is broken. What we need to do is work together as individuals and families and communities to change our health from the ground up. I'm Dr. Scott Fuller. Please join me again.